Welcome to Healthy Frontiers. My name is Dr. Bizzoni. I'm a chiropractor, and this show is dedicated to the education of our viewers. The topic for tonight is women's mental health and breastfeeding. My special guest is Regina Camillieri. Regina is an international board-certified lactation consultant and a marriage and family therapist. She practices at the Lighthouse in Croton-on-Hudson, New York. So she's right here in Westchester County. Regina has been working with new mothers for 20 years. Her lactation practice has expanded to include mental health, so she can now have an integrative approach to health care. So Regina, welcome to the show.
Thank you, Dr. Bizzoni.
Is this an unusual combination of disciplines, mental health and breastfeeding? Why don't you explain?
Yes, not very many lactation consultants become mental health experts.
Right.
So what happened was for 20 years I've worked with postpartum mothers in the breastfeeding arena.
Yeah.
And I was noticing an increase of depression and anxiety in mothers and new mothers.
Mm-hmm.
And I found that I was not reaching the whole person.
Mm-hmm.
And that I needed an integrative approach. It's not just about the breastfeeding. It's not about the mechanics of breastfeeding. It's really about the mother's emotional well-being at that point.
Right. Okay. Great. So, what is the most, or one of the most significant changes you've seen in the past 20 years in women you work with?
Well, I've seen a lot more of anxiety. You know,
Mm-hmm.
people talk about postpartum depression,
Yeah.
but a lot of people don't understand that the anxiety goes along with the depression.
Right.
And this postpartum anxiety manifests itself a lot of times with the mother not being worried about the baby, constantly weighing the baby, wondering if the baby's getting enough, even if they're bottle feeding,
Right.
you know, running to the pediatrician all the time, obsessing over the baby, not sleeping.
Right.
And I've had mothers sleep underneath the cribs.
Wow. Okay.
Yeah. So when I started seeing, and in 20 years, I've really seen this, an uptick in this kind of behavior.
Right.
And I just felt like it was time for me to get more education and training on the emotional well-being of new mothers.
Right. Great. So I think that most women are preoccupied with their babies, as you've just said. So how do you know when it's too much or too little, or, you know, should they be so worried all the time?
Well, I think new mothers naturally are worried about their babies. They
Yeah.
want to always do the right thing. You know, when you become a mother, you want to do it all right.
Right.
But the preoccupation really comes down to more of an obsessive behavior. Like I mentioned before, with them sleeping underneath the cribs,
Right.
sleeping next to the bassinet with their hands on the baby's chest to make sure the baby's breathing. And some very famous films have depicted this kind of image, you know, the mothers crawling in the cribs with the babies,
Yeah,
you
sure.
know, things like that.
Yeah.
And although it was done in a comedic way,
Yes.
it's a very real thing, and it's a very real fear that mothers feel guilty about. They know it's not quite right, but they can't explain what's happening
Right.
with the preoccupation of the baby.
I understand.
And pediatricians, of course, would know this. It's the mother that's always in the office. The mother's always showing up for a rash or a this or a that.
Yeah.
You know,
Sure,
and
sure.
the pediatricians don't know what else to do with them.
Right.
The baby's fine.
Yeah.
And I find myself in my office just reassuring the mother a lot that the baby's feeding properly, that the baby's gaining weight properly. You know, even though they see the numbers, there's still a fear that they're not doing the right thing.
Oh yeah, sure. I mean, and just you giving them that soothing conversation and just making them feel that they are doing the right thing, it goes a long way, I'm so sure. Right?
And dealing with the anxiety,
Yeah.
that is the big, you know, and I felt like I didn't have the tools to do that in the past.
Yes.
Now I do.
Okay.
And it became very apparent to me that this was the bulk of my clientele. It wasn't really, I've done talks like it's not always about the breastfeeding, and I really find that it's not always
Yeah.
about the breastfeeding.
Right.
It's more about the mother's emotional capacity to handle the big transition in her life.
Great, great. So, is this what's called postpartum depression and or anxiety?
Yes.
That's-
Yes.
yeah.
And a lot of people don't realize that they can go together, they could be separate, but most of the time they're together.
Yeah.
Mother's not sleeping because they can't.
Right.
They get in bed and they lay there awake, scared or anxious about their child. Mothers who are not eating, mothers who are not taking care of themselves. in the worst case scenarios, mothers who can't care for their own babies because they're so depressed they can't get out of bed.
Right.
Okay, and these symptoms usually appear when the mother has had depression or anxiety in the past, the birth of the baby, and relationship issues with the partner that she's had the baby with.
Yes.
If there's relationship issues, that just exacerbates the
problem,
condition.
sure. Yeah.
Birth trauma, women who have birth trauma, a horrible birth due to medical intervention or due to complications during the birth process.
Yes.
History of infertility. It's another really big one that we're seeing, and I think that's what has caused the uptick in the anxiety. And mothers of preterm infants, because they're always, there's a real fear that their baby's not going to survive.
Yes.
And women with no support from families or friends, women who are doing it alone.
Yeah, okay. So important. So how does infertility impact the woman's adjustment to motherhood?
Well, infertility, I've met women who've had 9 miscarriages.
Wow.
Thousands and thousands of dollars in fertility treatments, has caused a financial burden, has caused a burden on the relationship that she's in.
Sure.
And nobody could convince me that after 9 miscarriages, there isn't an emotional component to having a now healthy baby and not having mourned the previous miscarriages.
Yeah.
I've had women, for example, with 9 miscarriages, sit there with their brand new baby in front of me and say, I'm still not happy and I don't know why.
Oh, wow.
She
After
has
9
this healthy,
miscarriages.
yes.
Wow.
That's a lot.
That's huge.
That's a lot of physical and emotional roller coaster. Never mind you throw in the injections of hormonal injections, for the fertility treatments. It's a roller coaster for women.
Yeah.
It's an emotional roller coaster, and for their partners as well.
Yep. Right. So what are some of the real symptoms or some of the other symptoms of postpartum depression?
Okay. So some of the other symptoms of postpartum depression, and I'm reading this from the CDC's list of symptoms, lasting sad, anxious, or empty mood, feelings of hopelessness or pessimism. This is never going to get better. I'm never going to get sleep again. My life is never going to be the same. I can't believe I did this.
Yes.
I didn't realize it was going to take so much time and energy.
Right.
Feelings of guilt, worthlessness, or helplessness. A lot of women feel guilty when they don't feel that connection with their baby right away.
Yeah.
And the worthlessness that they're not doing it correctly, they don't know how to do it, they're afraid to ask for permission, ask for help.
Yep.
And a lot of young women don't live near their parents anymore, so we don't have that intergenerational connection anymore, to help you through those first few weeks.
Never mind intergenerational. How about parents both working then, it's a whole nother, right, go ahead, I don't want to interrupt.
That's true,
but that's,
because we all have to work, a lot longer than most of us want to.
That's right. That's right. And we see that so much now. In all the days, there was the mom stayed home a lot. And
yes, and then grandma would be there.
Grandma would help out, but no, not anymore, right? So that is another layer of stress, I would think.
Yes.
Right.
I think adds layer of stress for the entire family,
yes.
not just the family that brought home the new baby.
Sure.
Feelings of irritability and restlessness, you're not getting any sleep, because you're home with the new baby and the baby's waking up every 2 to 3 hours, regardless of how you're feeding it, and that could break some of the most rational people.
Right, yeah, for sure. Oh, yeah, definitely.
And I tell my clients all the time that that's why they use sleep deprivation as capital punishment, because it works.
Yeah, right, exactly.
It works.
Yeah, it works, for sure.
So,
wow.
Loss of interest in activities. The mom who doesn't want to leave the house.
Yeah.
Early in my career, I used to make home visits, and there literally were women who could not leave the house. They could not. They were afraid. What if the baby cries? What if I don't know what to do when the baby cries? And I don't think, I guess they were afraid of being judged, but it was more of their inability to be a mother that they were afraid was going to be judged or looked at.
Yeah, it may be their first time, of course, sure, they had so right.
There was one woman right here in White Plains who I went in, and she wouldn't even go into the lobby with her baby. We would take elevator rides, her and I, Just go down, let the door open, let the door close, go back to her apartment. Come back again, go down, let the door open, come out for 5 minutes, back in the elevator, back up to the apartment.
My goodness.
Until I could get her out the door.
Right. And the vision is that, you know, you have a new baby and everything's bright and clear and everybody's so happy. And
not for everybody.
Right.
You know, and women feel guilty about that feeling when they don't feel like exuberant over having this new child that's not letting them sleep or not letting them bathe.
Sure.
You know?
Right, of course.
Their life is, you know, over as they knew it.
Yeah.
You know, and the guilt that comes along with that really makes the anxiety and depression much more difficult for people to deal with.
Right.
The loss of energy, you know, again, the same thing. Not wanting to leave the house, not wanting to take care of the baby in some cases.
Right. Okay.
Problems concentrating, recalling details, and making decisions. And I've seen women do this, not be able to make a decision, and sit there completely flabbergasted. Recently, I just had a woman in my office who had a complete panic attack and almost passed out on me.
Wow. Okay.
Because it was so overwhelming for her to take care of this baby. And she had a terrible birth experience.
Yes.
She had a lot of birth trauma, and that made it worse.
Wow.
Difficulty falling asleep or sleeping too much, overeating or loss of appetite. A lot of women have a 2 o'clock appointment. My routine question is, have you eaten today? A lot of times I get, no. 2 o'clock in the afternoon, has not had anything to eat. Okay, thoughts, the most drastic are thoughts of suicide or suicide attempts.
Yeah.
You know, and we've all heard this sensationalized in the news, you know, mothers with suicide attempts or homicidal attempts on their children. Aches and pains that don't get better with treatment. I've seen that too, phantom pain. Back and forth to the doctor that something's not right, you know, and the doctor can't explain it, or the lactation can't explain the pains that they're feeling in their breasts, you know. So all this has to be looked at in an in-depth way, not just from a physical medical intervention, but also from a mental health point of view.
Yeah, I mean, even as you just going back to your question when you asked them about did you eat and it's 2 o'clock and they didn't eat, thinking what that may be doing to their blood sugar levels, and then now it just goes on and on. Right? So, okay, that was great. Most of those questions and most of those answers, right?
Yes.
That's it. Good. Okay, so I was surprised to find out that men can also have PPD anxiety.
Yes.
Let's talk about that a bit.
The CDC on their website had said that 1 in 5 men, which I was even surprised at that.
Shocking. 1 in 5, that's huge.
Yes.
Okay.
1 in 5. And it's been very interesting to watch the couples in my office. You know, it's not always men and women. You know, there's a lot of, you know, other types of couples in my office. But, you know, men who are detached, men who just drop the woman off and leave.
Yeah.
You know, men who drop the woman off and then she has to call them like 4 or 5 times to come back and get her. You know, and I see a lot of this happening. Well, not a lot, but I see a lot of it. And what's most upsetting is that the attachment to the baby is then interrupted.
Right.
You know, the mother and father's attachment to that child is both interrupted. Then it causes all types of relationship issues. Right. You know, I don't care what type of family you have, but it causes all kinds of relationship issues.
Yeah.
You know, I've seen this in same-gender marriages as well.
Sure.
You know, where one of the partners is feeling it as well.
Right.
And there's serious issues in the office. And I can't tell you how many times people have come into my office and I've done marital counseling instead of the breastfeeding.
Wow.
Because they're fighting.
Yeah,
they're screaming at each other in my office.
Wow.
And they're there for a breastfeeding. You know, all this... You know, led me to know that this is a much bigger issue.
Than yeah.
But for men, the postpartum depression, anxiety, a lot of times appears to be before the birth of the baby. It could be noticed. Also, birth trauma. If the the woman's going through the physical part of the birth trauma, but very often the partner has to stand there and watch.
Right.
The pain that their partner's going through, the possibility of the baby not breathing right away or something wrong with the baby. They have to make decisions because maybe mom has had anesthesia, you know.
Sure.
So this is very traumatic for anybody, male or female. It's just a very traumatic experience to have to go through. Also, history of infertility, because very often there's a lot of marital issues already surrounding the infertility.
Going forward. I mean, it could take, as you said, there were 9 situations there before this lady had the baby, and wow, that's a lot for any one person, never mind as a couple.
And do you know how many times I've heard numbers that high?
Wow.
Yeah, like now, 1 or 2, even those are traumatic, but up as far as 9, that's a lot to have to deal with, and that's a lot to have to process.
For sure. You would think that a lot of this depression will come after maybe parents who have lost a child, now they have a child.
Right.
And they're still going through the same kind of problems, so it's...
Because the loss has never been dealt with.
Right.
Yes. And I encourage any couple going through fertility issues to get help, to go for counseling.
Yes.
Because it's really important to keep your relationship together, regardless of what that relationship looks like. It's important for the relationship. So when the baby comes into the world, there's not all this commotion and disconnect that the parents have with each other.
Right. So how does all this relate to breastfeeding, Regina?
Well, it all relates to breastfeeding because there's, as we know, there's hormones all over the place, especially after you have the baby, okay?
Sure. Yep.
So when a woman has a trauma or has had a trauma, okay, there are certain hormones that will depress the hormones needed for breastfeeding. Oxytocin and prolactin are the 2 top hormones you need for breastfeeding. Any kind of dopamine, which is what we excrete when we're afraid, that flight or fight feeling, that will decrease the pitocin, no, not the pitocin, the prolactin or the oxytocin.
Right.
And that will in turn decrease the breast milk. So very often women are coming to my office because of low breast milk.
Right.
They're not producing enough to feed their babies.
Right.
And that is the presenting problem always.
All right. And then what do you do then? How do you what do you start recommending at that point?
Well, there's a lot of herbal remedies out on the market. Some work, some don't work for some women.
Okay.
There's other physical characteristics that could cause a woman to have a low milk supply. So I have to assess the situation, see if it's physical or emotional. Right. And the emotional component usually shows up pretty quickly. So
I got it. And I'm sure you work with the medical doctors or their OBGYNs at times if it's necessary.
I've worked with midwives, which was an excellent experience. I've worked with OBGYNs and pediatricians in the hospitals. So, you work with these doctors, but a lot of times it's just the woman's emotional component that I have to work with. Right. Something simple like just dance with your baby. Turn on music and just dance. Because that activates the other 2 parts of the brain and reduces the part of the brain that's feeling the anxiety. So
good.
Something so simple, and people look at me like I'm crazy, but it works.
Sure.
It works.
Okay.
Any kind of, go out for a walk. There's a lot of programs in the area for postpartum moms.
Yes.
And I often recommend one of those programs, like yoga programs or walking programs or meetups or things like that. Because any other kind of movement you could do will decrease the amount of anxiety that you're feeling.
Right. Perfect. So the mind-body connection is very prevalent when it comes to birth and breastfeeding and everyday life, right?
Yes, very much so.
So that whole, just what we've been talking about. So just so for the audience's understanding, what is a midwife?
What is a midwife?
Yeah, I know you worked with many.
Yes.
For many years, you have great experience. So, why would a woman want to even work with a midwife, just as an aside?
Well, a midwife is just an alternative to an OBGYN. And midwives are appointments, the appointments are longer at your prenatal appointments.
Right.
A midwife will stay with you through your labor. Right. They will help you have the type of labor or, avoid medications, have medications. They will help, enhance your birth experience.
Right.
You know, and I'm not taking away from any OBGYNs,
No, of course
but a
not.
lot of women love the midwives because they're given a lot more choices in how they birth their babies. There's water births, there's hypnobirthing.
Right.
You know, a lot of midwives use doulas for the birthing as well,
Right.
which doula is a Greek word meaning helper. So the doulas will help with the birth as well, which will make the mother feel more confident and more able to go through the pressures of labor.
Sure, and I'm sure the mother can have more access to a midwife than they can to an OBGYN because they're always around, right? As much as you need.
Yes,
Right.
definitely so.
Right.
You know, just the appointments being longer.
Yeah.
You know, I can remember when I was having my children. You're in and out in no time.
Right,
you know,
right,
like,
yeah.
and you're like, oh, I forgot to ask this and I forgot to ask that. Where a midwife is more accessible, like you said, and the
Right.
appointments are just longer, so you have time to ask those important questions, especially
Right.
if you're a new mom.
Right, great. So how can a family member help a new mother who is struggling?
Support her. You know, cook, bring food, because that's
Right.
always important.
Sure.
Do a load of laundry.
Yes, okay, perfect.
You know, wash the dishes. But
Right.
also, if the mom is not eating, you see signs of the depression or anxiety, not eating,
Yep.
not sleeping, sleeping underneath the crib, sleeping with the arm in the bassinet, making sure the baby's breathing. Anything that looks a little out of the ordinary,
Right.
you know, try to gently talk to the mom into getting help.
Got it.
You know, especially if she's not eating and or sleeping too much and not wanting to take care of the baby. You know, these are all things that family members should really watch for.
Right.
And you could be very instrumental in getting that woman help and getting a healthy relationship between mom and baby right from the beginning.
Understand. So, Regina, why don't you just, if I were to come into, or mom would come into your office, why don't you just walk us through that? You know, what would that look like? Did they fill out some forms?
Oh, there's
what
always
happens?
forms.
Yeah, I'm sure.
But I'm proud to say in my practice, I've made a paperless, so it's not
Perfect.
as cumbersome for the moms
Right,
coming
right.
in.
They have enough on their minds.
Yeah, they have a new baby and they're,
Right.
you know, like
Sure.
trying to juggle everything all at once.
Sure.
So after the forms are filled out and the questioning about, you know, so what brings you here today? That's usually my first line.
Right.
What brings you here today?
Right.
And listening to the entire thing and the entire experience. A lot of women start from the moment she gave birth.
Right.
She'll start from there.
Right.
Even though that may not have an impact on what's happening today,
Right.
but that's where they'll start. And listening to that very carefully about her experience from that birth on.
Right.
Looking at the couple before you, if there's two people before you, and
Right.
what that is like.
Right.
You know, is somebody checked out? You know, is she here alone and terrified to drive by herself, but she made it there?
Right.
Is the couple arguing in front of you right from the start?
Well, that's important, of course. Yes, for sure.
And then, you know, when you move on to, you know, there's a weight taken, and then, you know, I determine whether or not the weight is appropriate for the baby's age.
Right.
Based on the birth weight and the discharge weight. And then after that, you know, I assess the breastfeeding. But seeing how the mother is with that baby.
Right. Yeah.
I've seen mothers not even look at their babies. I've seen mothers completely disconnected. You know, like being very mechanical, not holding, hugging, cooing.
Yes.
And it's so interesting to watch different cultures and the way they coo with their babies.
Sure.
It's so fascinating to me.
Yeah.
But to sit there and see how they interact. You know, if there's none of that going on, the kissing, the gazing, the, you know, like, oh, they're just so perfect, or, you know, any of that, then that's a red flag for me.
Yeah.
You know, then I
Sure.
might say again, you know, so what went on during that birth? You know, what would you have liked to have something different happen?
Right.
You know, you start to explore things. You know, if it's a relationship problem, unfortunately, you have to bring it into the room.
Yeah, I was just going to say, at what point do you say, you know, maybe we should have your husband here, right?
Well,
Or-
you know, sometimes if the partner's sitting in the waiting room, I'll ask the woman first, would
Right.
you like the person in the room with you? And a lot of women come with their mothers and sisters and aunts, and,
Right.
you know,
Yep.
I had one girl come in with 3 of her sisters
Right.
because they did everything like that.
Right. Sure.
But you know, it's important to, you know, bring that other person into the room. And I've had women adamantly say absolutely not, and then other women say, well, yeah, I guess you could bring the person in,
Right.
And sometimes they have issues with their own mother.
Yeah.
And the mother's there, but, you know, yeah. So
Right.
it's really a delicate situation when you have to introduce that kind of topic. But it's important for the mom's mental health. And it's also important to bring it out into the open. You know, very often the signs and symptoms of postpartum depression are this.
Yes.
You know, I could see by you not eating, you told me you hadn't slept in, you know, since the baby was born.
Right.
You know, things like that you bring to their attention.
Right.
But you have to be very careful because people think that postpartum depression is both something as simple as those things that we mentioned or something as critical as psychosis.
Yes.
You know?
Sure.
Where suicide and homicide is considered.
Sure.
So, and people get upset when you mention postpartum depression. They're like, oh, no. And I, you know, and I always say to them, I'm not talking, you know, it's a continuum. It's not here or there.
Yeah.
You could be anywhere in that middle.
Right.
You know, and that's what you have to explain to people. And some women are relieved to find out that, yeah, something's going on. And other women get angry because they don't want the label. And I can't say I blame them.
Yeah.
But, and then, you know, then if you have a partner who thinks they're, you know, know-it-all, they're like,
yeah. Then you're in trouble.
That starts a problem.
That's a whole other problem to deal with.
He's telling me this, or they're telling me that, yeah. So.
Well, Regina, that was terrific. I know Regina's work. I know of it. I know of her patient. She does fabulous work. You couldn't get a warmer person or a more professional person. So I want to thank you for being on the show.
Thank you very much.
Okay, it's my pleasure. And we look to see you on the next episode. Thank you very much.